Hello, Dr. Crose here with Capitis Medical and Aesthetics. I'd like to talk about something I discuss with my patients all the time, which is stem cell source as well as what they're best suited for in terms of treatment. So there are very few studies, period, that look at this. I was actually at a loss when I started doing a search myself, but was able to find a handful of studies that looked at bone marrow, umbilical cord, placental, as well as fat sources for mesenchymal stem cells. They looked at their potency as well as their efficacy in terms of how well they work on the different tissues that you apply them to. What was interesting that came out of this was that it seems like bone marrow is a little bit better at treating immunological or immune system type of functions, and it induces a better response in the white blood cells in the body. Whereas umbilical cord and placental tend to be more pluripotent. They can evenly work across the field, and they're very, very good at tissue healing and regeneration. Fat is also good, but it seems to be lower in all categories except for the neurological areas. So fat sources can be good when you're actually trying to treat some type of neuropathies or radiculopathies or neurological issues, but in general they tend to be less potent across the field compared to the other three. So I highly recommend that you find out what type of mesenchymal stem cells you're using, and also what type of mesenchymal stem cell exosomes or extracellular vesicle you are using. This is very important when you're choosing what ailment to treat, and I highly recommend doing some reading on your own. It's an interesting field, it's wide open, and there still is a paucity of studies out there. I think everybody needs to really push their provider to look into this more. I look forward to more studies coming out in the future. Once again, Dr. Crose, I hope you have a wonderful day.